Professors of economics from University of North Carolina in Pembroke. And I do teaching and research basically, and my research mainly in medical tourism. That's my passion. First of all, the reason I am coming to this Congress 2013 here in Las Vegas is because I was invited. And secondly, I think this would be a good opportunity for me to do networking with the medical tourism facilitators and other research scholars who are doing the research in this area, as well as the third-party payers, lawyers, and it's a great way to find out what MTA has been doing in the last 5 years since my first attendance in the first Congress in 2008 in San Francisco. I would say my role with this particular conference is to basically educate the industry a little bit about the research area that is going on right now. I've done research in this area for the last 6 years or so. It started when I was in Singapore, and right around 2002, that's when India, Singapore, was advertising medical tourism highly. And one day, 3 of my students came to me and asked me if I would supervise them for their final year project on medical tourism. I said yes. So I got started then, and most of my research collecting data, hard numbers, statistics, and I love numbers, and I think one of the things that is lacking in this medical tourism's research areas is data, and because we need to have evidence-based research. And I've done some consumer study, consumer survey, finding out their perception about medical tourism, and finding out where they're going. I have developed, my colleague and I have developed 4 modes, how the patients who travel to another country, basically, do they go on their own, do they go through the agent, do they go through their insurance company, or through their domestic doctors and hospitals. And another thing that we have done is the collecting survey of MTF, the medical tourism facilitators, like what are their roles in medical tourism. And right now, under construction, we are also working on a project on insurance companies. So I think those are key players in medical tourism. Well, one of the key players, there are a few, one of the key players, of course, consumers are the key players, the hospitals are the key players, and the agents, the facilitators are the key players as well. I think the most important one is the consumers, basically. And in the latest studies that in my research, the one that I presented yesterday was on the 4 modes of medical tourists. And one of the findings I have is the differences between the younger people and the older people who are above 65 years old and people who are below 65 years old. If you look at the latest health data, you could see that the age group of 45 to 65 years old are actually catching up with knee replacement now, because those are the active generations. They want to stay active and they want to get back to their social life and their work life. So they actively seek knee replacement as one of the examples for medically necessary procedures. And you will find that this generation, basically, they go on their own. They're more likely to go on their own because they are they're more independent as compared to the older, above 65 years old, who are having more hardship in traveling. So that's one of my key findings, that the younger people are open to medical tourism, and especially when it comes to knee replacement. Again, if you look at the number in the U.S. now, that age group of 45 to 65 years old is jump up by about 48% in the last 5 years. But if you compare it to the UK or Swedish data, and the or the average age is about, for England, it's about 69 years old. But for Swedish population, it's about 75 to 85 years old. So, you look at the US population, the patients are a lot more younger. Patients who actively seek for knee replacement. That's not to say that the older population are not seeking knee replacement, they still are, but this younger generation are catching up.